Morning, good morning. How are you today? We are excited to have our guest here on this platform. This is the Empowering You Nurses show, and I'm Dr. Miriam Smith, the host for that. And as you know, we have been having different guests on our platform, and they are valuable resources. They provide that for us. And so today, as we are coming to the close of Black History Month, this is the last Sunday in Black History Month as we celebrate. We know that we have trailblazers. We have had those who have passed on before us and have left a legacy for us to continue on. And therefore, we look forward to hearing from individuals who are continuing the legacy, magnifying the voices, and of course, uh, magnifying the voices of those who have passed on before and be encouraged as they have contributed and we continue in this path. And so today we have with us someone very special. I want to say welcome to our regular audience and of course to our guest. We have somebody very special and she's going to tell us something, her name, and tell us something about herself as we move forward in this exciting program.
Good morning, everyone.
Good morning.
Thank you so much for the invitation. My name is Rosharde. My name is Rosharde Bryce Douglas. I'm a licensed master social worker here in the Bronx. I've been in the field for over 10 years, working in different settings, currently in a mental health hospital.
Great. So what
So glad to be here. And
Thanks for accepting the invitation. Now, tell me or tell us, what is it that motivated you to decide to become a social worker? What is it that is it in something in your background or let us, what's made your passion that you really wanted to become a social worker? Tell us.
from a young age, I've always wanted to help, just to be in a helping profession. My parents, they were in the medical field. They are in the medical field. My mom is a nurse. My father is a respiratory therapist. And I thought of a profession that I wanted to be in that was similar, but something where I could just talk to people one on one or be more, of a help. And when I went to when I was completing my final years in my undergraduate, I started looking into what I wanted to do next. And social workers, they just seemed like they were very hands-on and worked with those in the community and things like that. And I thought that would be something that I would be interested in doing. And I like that the field is so broad. You social workers, you can find them in schools, in the hospitals, clinics. They're in so many facets, and you can always, kind of switch around and get to see different aspects. So that was what really interested me, being in a helping profession.
That's great. That's great.
Yes.
And it's interesting that you have said that because when I was growing up as a little girl, I wanted to become either a nurse or a social worker. And I had chosen nursing, and I haven't regretted it at all. And the interesting thing and with that is that we have collaborated. We work together with the patient at the center of it. So we collaborate so that that patient can receive high quality care and can return to optimum health and be able to contribute to society. Now, you just mentioned about being in the community and mental health. In these times, we notice that many individuals have needs, and COVID passed, and it has left some residues in some individuals, and you have to cope with that. Can you tell us a little about the community and mental health? And maybe you can add to that what the stigmas are like from your experience.
In my experience, for the Black community with mental health, it's definitely a growing problem. And as you mentioned, there's a stigma. It's something that's not frowned upon or is not easily addressed. Um, in my work, I come across a lot of have come across homeless individuals,
Mm.
issues. They would have mental health and sometimes substance. So mental health, yes, you see a lot of that. You mentioned COVID, um, just finances. In New York City, there's a big homeless crisis, a housing crisis. So you find people displaced and things like that. And so these things kind of exacerbate the mental health issues, a lot of depression, anxiety, um, a lot of the members in the community. You'll see bipolar, a lot of mood disorders, things like that, and things that are not addressed. A lot of times they're addressed through substance use. Um, so sometimes you wonder, was it a substance use or was it because of a mental health condition? So
Wow.
lots of issues around mental health in our community. And um, even though there's care, sometimes the wait may be long. And a lot of times it's more medication. They try to just medicate. And then when that doesn't work, then they self medicate, sometimes with substance. So, yeah, this has been my experience
Wow.
so
Thank
far.
you so much for sharing that because, sometimes people might see individuals out there, uh, if they had been given a chance or a second chance or some intervention at a certain point before they have reached that level of maybe depression. Because think about it. Someone has been working and has lost a job, and the
Yeah.
rent to be paid, the basic needs to be met and are not being met. So there are times when it never started as maybe a hereditary problem or stuff like that, but it's because of the we would say the determinants, the social determinants
Mhm.
there. You see, how do you help like the marginalized individuals in your work in terms of being a social worker? How, in some ways, do you think or have you helped or have seen things put in place to help these individuals in any way?
Yeah, so there are different many programs across the city. Most of the times it's just to be aware. So yeah, we um when I come across these individuals, just doing an assessment, of their basic needs and what are some of the things that they need, and linking them to resources. So there are resources there. Um, social supports, linking them. The first thing we want to do, coverage, medical, mental health, making referrals to mental health clinics. So many of them offer different programs, groups, things like that. So it's basically individually assessing the needs of that person and connecting them to resources, whether they may need housing, whether it's financial, educational, whatever the situation may be. We want to make sure that mentally and medically that they have those connections, and then any other resources that they need, then we can also link them to those in the community.
Thank you so much for the great work you're doing there in the community to make this community a safer and a better and a healthier place. Now, let's think of from listening to you today, there might be some young people, or maybe someone had been in another profession, but they're aspiring to become a social worker. What would be your advice to them? These individuals and your vision for them. What would that be like? What would you tell them? They want to
So
become a
welcome.
social
I would
worker.
welcome them to the profession. And yeah, I would say, think about the area that you would want to work in, what population. So, you have children, adults, families. Um, just try to think, research the organizations.
Mm.
So many when you become a when you're in school for social work, there's internships, and you get exposed to different agencies and different things that they're doing for the community. Just try to think of your niche, like where you would want to start. And again, you could always change, but I would just suggest that, think of that, and then research areas or agencies in the community that work with that. Maybe look at their mission and their vision, and see if that aligns with something that you want to do. um, Having good mentors, speaking to other social workers, getting their um, input on experiences that they've had or places that they've worked or things like that. I would just say, like, create that network, try to build that network. Sometimes we do get it while we're in school, and just continue with that. I reach out to a lot of my social work friends even now and would ask them things. There's groups online. Yeah, just try to, think of the area you want to work in and just try to network. And there's a lot of support out there, um, that could help you along the way. But it's the passion, just having that passion to work with whatever population, and just, getting out there and, and doing it. The field is wide and open, and, we need social workers every day.
Thank you so much. Are you hearing there? Those of you in high school and those of you who are in another profession, but you want to learn and you want to become you're aspiring to become a social worker. Thank you so much. As we're coming to the end of our session this morning, I know that you're a hard worker and you have others who work relentlessly. They work so hard to help for the health of the nation. But when it comes to self-care, you know, we have the interprofessional team, social worker, we have the nurses, we have the doctors, we have the respirator, and you're right in the middle. Your dad is a respiratory therapist, your mom is a nurse, and you're a social worker. So you have a team right there already. And then we have additionally occupational therapists. We have the different disciplines, of course. Now, sometimes because of the magnitude of the workload, we as nurses, we as interprofessional social worker, you become burnt out.
Yeah.
All right. So you have compassion fatigue because you have been doing so much, you forget yourself. And recommending we need emotional stability. We need we need to be spiritually well to cope with some of the complexities of what's happening around us, and especially today when there are so many fears out there. Are there so many fears out there? Now, tell me, or tell us, tell the audience as we close, what could be some of the self-care thing that we get ourselves involved in, you know, to ensure that we're not burnt out or we're balanced? Tell us anything that you think of, because I'll add mine.
Okay, so definitely resting when you need to, taking the break when you need to. While you're in this profession, you are offered paid time off, making sure that you take your leave when you need to take your leave. Um, Getting enough rest, having a well, trying to eat well, a good balanced diet, having exercise, spending time to rest, relax, exercise, even daily. Spending some time every day for yourself, taking some time for yourself, um, quiet reflection again, like spiritually, in your mind, prayer, making sure that you're connected to God, or if you want to meditate, but just some time where you're balancing your mind, you're quieting down, and you're spending some time to rest and relax. And I would just say too, social supports, those connections. You know, we I'm a 7-day Adventist, and I'm at church with my church family. And that, when I see them on the weekends, I've had a long, busy week. And just connecting with, I mean, we connect sometimes throughout the week as well, but seeing each other and fellowshipping and just spending time together. We usually spend most of the day together. That's also important. Having some kind of social connection, whether it's family, your church family, friends, spending time with others too, building those connections. So there's many things that you can do, but definitely taking the time for yourself to cut off from the work, and just taking the time to sit with yourself, meditate, connect, things
I
like that.
love that. I love that. And I love that as we close. I appreciate you coming on. And in addition to what you have said, when we think of being temperate,
Mm-hmm.
not overdoing, resting at intervals, nutritious diet, take time out, trust in God, you know, get some sunshine, some fresh air, some exercise, walk out there, have good relationships, have like-minded people in your corner
Yes.
where the positivity radiates. That's in your atmosphere. That's in our atmosphere because negative things pull you down while positive pulls you up. And so, in closing, I just think of the positive mindset or the growth mindset. Help to share positivity around. And as we come to the close of Black History Month, we are coming to the close of continuing the legacy, but this high peak celebration. So let's endeavor to remember that each person is important and each person is valuable and each person is taking something to the table. And let's develop, if we have not been doing that, a listening ear, active listening. When someone else is talking, give them your entire attention. Mindfulness, you know. So I just want to say thank you so much for coming on my show. And I know I know. I'm wondering, have you read or have you seen this book, Nurse, The Guide to Empowering New Nurses in the Delivery of High Quality Care to All Patients? Have you seen this book?
I
Yes. Yes. So, what's your response? What would you say to anyone about this book?
Oh, I would say that it's a great read. I got it for my mom, who's been in the field. It's just a great guide, and definitely empowering nurses. Giving them like the guide that they need. And I think it's a good read. It's a good read.
Thank you. Thank you for that. Well, I must tell the audience and the others that they can share this with. Nurse, the guide to empower new nurses in the delivery of high quality care to all patients. So regardless of your color, your creed, your intelligence, whatever, your orientation, listen, your norm, this book is a must read. And if you go on Amazon, you will see it there and you will see the ratings because many years, I'm in nursing for more than 4 decades, and I have gained knowledge both academically and clinically. And I've shared many tips, pearls, nuggets in this book that can help a nurse, a young nurse, or even a seasoned nurse. Because I remember talking to a seasoned nurse and she said, Miriam, you know what? It was a refresher for me. And so for those who have not yet read this, you'll notice on my platform, I've interviewed even laypersons who have read, and it was so helpful. And you'll hear their discussion. So you got to go on YouTube at Miriam Amanda Smith. Look this up, subscribe. The book is on Amazon, it's an Amazon bestseller. Okay. And you can go and podcast Mirror. That's Instagram. Okay. And as you do that, you can just subscribe. You go and podcast is empowering new nurses. If you haven't got a copy, you need to get your copy. And you need to share this with others. And please subscribe. It's important to subscribe. Make a comment. All right. And you will see as you share, others will be informed and can make decisions from that being informed. When you go to the hospital, there might be some things you're looking for. This can help you also. So I just want to say thanks to my audience and a special thanks to my guest, Mrs. Bryce. Uh,
Pleasure. It was a pleasure having this chat with you all.
Thanks, and look forward to seeing you again. And share it with your other friends because sometime we might have more than two persons on. and we can divide it into sections. And so we look forward to having you again, and blessings for the new year and everything.
Thank you. Same to everyone.
Bye. Bye.